So thank you so much for coming back to watch this video. So welcome to Beyond Your Knowledge. So today we are going to be discussing a topic which is about the autosomal dominant polycystic kidney disease. Okay, so but before we continue, I would like to share with you Psalm 119:105, and this psalm read as follows: so your word is a lamp to my feet and a light to my path. Amen. Well, so with that in mind, I think that we can move on to understand and learn more about the autosomal dominant polycystic kidney disease. So first, when we are talking about the autosomal dominant polycystic kidney disease, we already know when we put the word dominance, which is related with genetics. Okay, so I would like to show you a picture here about how is the patterns of inheritance. So in this case, we're going to be focusing more in this disease, which is polycystic kidney disease, but it is autosomal dominant, and so since it is autosomal dominant, I think would be a good idea if we can see the difference between autosomal dominant and autosomal recessive. So basically, just here in this area, so we have the autosomal dominant on my right, okay, so and then autosomal recessive on my left. Okay, yeah, autosomal dominant, as you can see here in this pattern, so the affected, it is in blue, okay, and the one that is not affected, it is in this kind of yellow gold. Yeah, but yeah, so basically, if this couple, the man and the woman, get married and they have children, because he is dominant, so you are going to be for sure that your child's the probability to have more childs with the disease is high. So if you see this couple, so this child is affected and this another child is affected, okay, but it's basically 50 and 50, okay, so because the unaffected child is just here in this pattern. Okay, now autosomal recessive, to get the, now go to the left here, to get the disease, so you need to have part of the gene from your mom and from your dad. So and then when you put together both of them, so then you can have this affected child. So the probability of affected child with the disease is less. Okay, now what about if you get half and a half? So you're going to be a carrier at these two child, but if you get the good gene from dad and the good gene from mom, so you're going to have an unaffected child, which is this one. So basically, this is the the overview of the patterns of inheritance. There are more things, so but we're not going to do that deep in that right now. But right now we're going to go better and explain so the things about the autosomal dominant polycystic kidney disease. So with this, I think that we can get a better overview, as we mentioned genetics. So, and what we can say about genetics, so we already mentioned one detail, which is autosomal dominant, and I'm going to abbreviate it. And but where is the mutation of the autosomal dominant polycystic kidney disease? Well, the mutation, it is easy because the name basically is giving you the gene. So it is polycystic kidney disease, PKD1, or polycystic kidney disease 2. Okay, now this causes, what is going to causes, okay, this is going to causes that increase your tubular cell proliferation and cell and fluid retention. So that causes, so this gene is going to cause that your tubular cell proliferation increase, as I mentioned. And if you have more proliferation of this tubular cell proliferation, you have more, so also you can get fluid retention. Okay, remember our problem here is basically with the kidney. Okay, and if you have fluid retention, that bring a lot of consequences, because the patient get edema, then the patient can get an asarca, which is all the whole body's retained body fluids, and so the patient can get shortness of breath. So it's a lot of things that can come just for that. Now let's just talk a little bit more now of the pathologic features of this polycystic autosomal dominant polycystic kidney disease. So what are some of those? I'm going to switch to blue. Yeah, now let's just continue the pattern. Yeah, so the pathologic features. Sorry. I just didn't notice that I was writing on black, so but that's okay. So basically, pathologic features. So the patient is going to have a cyst formation. Okay, so which a cyst basically is like a sac with fluids. Okay, now this cyst formation, if we are talking about which is the disease is in the kidney, what is the cell that is in the kidney? Yes, you are right. It is nephron. So that means that this cyst formation is going to occur in any part or any point in the nephron. Okay, so cyst formation in the nephron. Now, with less than 5% of nephrons affected. Okay, so which is, I think, so with, I'm going to read this, less than 5% of nephron affected. Okay, now what else we can talk about the pathologic features? Well, let's just see here. The microscopic cysts present at birth, progressively enlarge over the decades. So basically it is a progressive disease. Okay, so basically when you're born, your cysts are small, so microscopic cysts when you at birth, but then eventually they increase. Okay, eventually increase during decades. Okay, so for example, probably you will see patients like 50s, or yeah, so take decades to increase those cysts. Okay, cyst. Yeah. Now imagine if you start to increase this cyst and all those things, so then it's going to cause atrophy, and then because come the process of healing all those things, it's going to cause fibrosis. We're going to be surrounding the parenchyma. Okay, so the patient is going to present with atrophy in that area, I mean the parenchyma, and fibrosis. Okay, and also as where, so in the parenchyma, as I mentioned before. Now let's see what are the clinical features. Okay, yeah, so probably we still have some room here. Yeah, so one more here. Okay, so let's just see the clinical features. Now what are those? How do you think that the patient is going to present? Well, so the patient, sorry, here is okay. Now, yeah, so the patients, if let's just go to common sense. If the patient has born with the with autosomal dominant polycystic kidney disease, so microscopically you can see when they born but they show that the cysts become bigger and bigger over the decades. Well, so before all those, so do you think that the patient is going to be symptomatic or asymptomatic? Well, the patient is going to be asymptomatic because take long, okay? Now, often that's happened, but another thing is just the location of the kidney. So retroperitoneal, so all you can so what are in which cavity, all of those things. So because the pain can reflect in, so the patient is going to have pain for sure, because then eventually it can become bigger, and but the pain where in the abdomen, okay, and flank pain, okay. Yeah, flank pain is right, but just with K, not just, I thought that was yeah. So flank is just right there. And now, do you remember that one of our organs, who is one that's helped to regulate your pressure, is the kidney, and the nephron of the kidney is going to be affected because there is going to be a cyst which is growing. So do you think that the patient is going to have hypertension? Yes, the patient can have hypertension. Now, what about if the patient has this cyst continue growing one time, this cyst is going to break. So if this cyst breaks, so the patients can present with hematuria, so due to cyst rupture. Okay, now what else we can see in this kind of patient? Well, if you see that the patient, the kidney and the nephron are getting atrophy and getting fibrosis because the cyst is been growing and growing. So one time this stopped working well, so and then the patient is going to present with progressive renal failure. Okay. Now, do you think that the patient, and I'm going to we're going to continue in the other slide better, because I think that then we can have more room here. So let's just put this here. Okay, let's just do this here. Okay, and then yeah, so let's just continue here. Remember that we had so we have the clinical features, so that we were seeing. So I'm going to, well, I think clinical features by the kidney is okay. So all those, I mean, then we can figure out all the other more science things that the patient can present according to this. Those are the main one. So, but do you think that the patient can have an extra renal manifestations? Well, yes, the patient can have an extra renal manifestation. So, what kind of extra renal manifestations the patient can have? Well, the patient can have two. One is another cyst located in the liver cysts, and the patient can get a cerebral aneurysm. Okay, well, cerebral aneurysm. So cerebral aneurysm, remember that aneurysm basically is, this is your normal vessel, okay, then this is the normal, then if you have an aneurysm basically, and then you have a connection, you're going to have like a balloon, okay, like a balloon, and then so the danger of this is that this balloon continues spreading up and opening until one day it's going to plaque, it's going to explode, it's going to break, and this is not good. So because then come bleeding, then the organ affected, so it's going to have ischemia or bleeding, and then the patient can get a stroke or all those things depending on the area of the aneurysm. Well, yeah, so just right here, aneurysm. Now, I think that basically is that with those. So, but you're saying, okay, now I know, and I can get I see the patient come with me, the patient has an hematuria, So the patient has a pain in the patient can have hypertension, hematuria. Until now I have 3. So, and what else should I do to confirm or to do the diagnosis of this patient? So first, what is the pathophysiology, or what is the consequence that the patient has? So the patient has a cyst formation. So if the patient has a cyst formation, how we can diagnose the cyst? So you need an image. So what kind of image we're going to do? So we're going to do an abdominal, because in the abdominal imaging. So but this abdominal imaging shows the renal cyst. Okay, now yeah, there we go. So I think, so what do you think? Does the patient, if you see that the kidney is not excreting enough and it's not working well, so the bacteria can go in, and then the patient can get urinary tract infection. Okay, and if your kidney is failing, so then you cannot excrete as well, and then probably you cannot, or you're not drinking enough water, or for any reason there is no intake of water. So which one of the things? So the patient, so to avoid this, so the patient can get kidney stones. Okay, yeah, but basically the patient with this kind of disease, so we need to just keep monitoring them, and then give treatment and treat the symptoms, the signs, and just figure out what else we can do with them. Here in the diagnosis, so I think that CT scan imaging will be good. So because you can see the cyst in the liver, or you can see the cyst in the kidney pretty clear. Well, thank you so much for watching, and remember, we can do all things present in us, and God bless you.